All right, good afternoon, everyone. I'm Valerie Camillo. I'm the President of Business Operations for the Philadelphia Flyers. Thank you for being with us here today. We're so honored to have with us Dr. P.J. Brennan, Chief Medical Officer from Penn Medicine, and of course, the Governor, Tom Wolf. We're here because we're all committed to helping end this pandemic. And some of you might be wondering, what does a hockey team have to do with the public health crisis? And for us at the Flyers, we think of ourselves as much more than a hockey team. We recognize the powerful platform that we have to make positive change and to influence. And so we want to be a force for good in combating this pandemic. Both Governor Wolf and Mayor Kenney encouraged us to get involved in the fight against COVID-19, and we've been doing that really throughout the pandemic. In the early days, we were encouraging mask wearing and social distancing. And in recent weeks, we've pivoted with our Take Your Shot campaign to addressing vaccine hesitancy and encouraging the community to take their shot. As part of the Comcast Corporation, we are uniquely positioned to help as a sports franchise. We have Comcast through NBC Universal has a national program and resource center called Plan Your Vaccine. And our campaign ladders up to these important resources, which inform members of the community a variety of information about the vaccines, but also lets people know where they can go to take their shot in their local community. We're the only NHL team that has a comprehensive campaign to encourage vaccination, and we're proud of our role in such a way. Our campaign has three main elements. We have our website, which I referenced, which provides information on vaccination and where you can receive your shot. We've also developed a PSA that features our players, our coaches, and other members of our organization, sharing information and encouragement around vaccination. We're running that on television, social media, and also in arena. We have almost 3.5 million followers on social media, and many more on NBC Sports Philadelphia, so we know that our message can reach a great amount of people. We're also providing on-the-ground support. We've made a donation to the Black Doctors Consortium, and we've been on site at vaccination centers both at Temple University and with Penn Medicine in Radnor. We've been handing out goodies and just creating a positive environment as people receive their vaccines. The Flyers are part of the fabric of the community. We have three goals. First is to win a Stanley Cup for the city of Philadelphia. The second is to have the best fan experience in sports right here at the Wells Fargo Center. And the third is to make a positive impact on our community. And this campaign is aimed squarely at that third objective. We've got the pandemic on the ropes. We're ready to deliver the knockout blow. We want to get back to doing the things we love, like sitting in this arena shoulder to shoulder with 20,000 other fans cheering on the Philadelphia Flyers. So our message to everyone is take your shot. And now I'd like to introduce Dr. P.J. Brennan, Chief Medical Officer, Penn Medicine. And from the very first days of the pandemic, Dr. Brennan and the Penn Medicine community have been an unbelievably valuable resource to the Wells Fargo Center and to the Flyers, helping us navigate the pandemic, providing advice and resources to help us safely reopen. And we're so thankful to you, Dr. Brennan, and to your team. So please welcome Dr. Brennan.
Thanks, Valerie. It's a pleasure to be here today. And thank you for those kind words. And Governor Wolf, thank you for being here today, too. We really appreciate your support. A week ago Saturday, we were out at the Radnor High School conducting a vaccine event. We vaccinated 3,000 patients there, and the Flyers team was out there. Gritty was there. I tried to give him a hug, but the Flyers team stopped me and emphasized social distancing, and I had let my guard down there for a minute. The Flyers cheerleaders were there, and I got to spend about 30 minutes talking to Bob Kelly. And it was perhaps the most enjoyable 30 minutes I've spent during the entire pandemic. Bob, as you know, is a Philadelphia sports hero and legend, and an original member of the Broad Street Bullies. And it gave me insight into what the Flyers were about in this effort, and that they were really deeply committed. Bob wanted to talk vaccine. and it really gave me insight into how committed the Flyers are. So that was really a great experience, and it emphasized to me how this work requires partners. And we've been trying to partner throughout the community to vaccinate patients. That's never been more important than it is right now, because right now we're at the toughest part. Beginning in December, we started to vaccinate healthcare workers in the city of Philadelphia, and thereafter we got out into the community. 6 weeks, 2 months ago, you could have set up a pop-up site on any street corner in Philadelphia and you would have had a line down the street and around the block. That's changed. We've reached the part of the campaign where we're dealing with those individuals who have not yet made up their mind, who remain hesitant, and we really have to work harder to get people out to be vaccinated. So community partnerships are more important than ever. They support our effort. They help us find citizens and encourage them to take the vaccine. These vaccines are safe and effective. Penn Medicine is excited to work with the Flyers in this effort. They're the kind of partner that we need to accomplish this work. They're trusted, they're known in the community, and they've been a long-standing member of the community. To date, Penn Medicine has administered over 420,000 doses of vaccine, 90% of these to patients and community members. We've done this through partnerships with pastors and congregations, through recreation centers, schools, and trusted partners like the Flyers. We've reached out to the homebound and those living in senior centers. Although we're in the hard part of the campaign, it's really never been easier to take your shot. All of our sites, and I think sites all over the city, but our sites at the hospital, the University of Pennsylvania, at Pennsylvania Hospital, at the Theater of the Living Arts, and at Penn Presbyterian Medical Center are now walk-up sites. We'll still schedule you for an appointment, but anyone can walk up and get the vaccine. So I want to thank the governor again for being here, and I want to thank Valerie and the Flyers for this important effort that will really help put us over the top. So please be safe in the best way and take your shot now. Thanks.
Well, now I'd like to welcome a very special guest that all of you are familiar with, a great leader in the community and the city of Philadelphia. Oh, look who here he is. Gritty? Gritty couldn't help but want to come out and meet you. I think he has a question. Oh, some messages. Here we go. Oh, I think he has some more. Well, I want to present you with one of Gritty's stickers.
Oh,
it says, "I took my shot."
Thank you very much.
He helped design them himself. Please welcome our governor, Tom Wolf.
Okay, I don't know how I can follow that. I mean, really. Thank you, Valerie. Thank you, Gritty. Thank you, Dr. Scott, and thank you all for being here. This is really important. I'm here because I really want to applaud what the Flyers are doing, what Penn Medicine is doing to make sure that we keep pushing on this vaccination front. And the fact that you have the Flyers and Penn working together is really important. As Dr. Brennan said, things are different now. Just a short time ago, you would have had a line around the street had you had a site set up to give vaccines. Now we really have to work a little harder to make sure people get the vaccines, but it is no less important now than it was just a few weeks ago. And it's really important that we get back to normal as quickly as we can, and vaccines are the key to that. Simply said, we need more Pennsylvanians to get the vaccine. So I joined the Flyers in urging Pennsylvanians to take your shot. If you do that, you're being part of the COVID-19 solution. And we all have a part to play. Every single one of Pennsylvanians, every single Pennsylvanian has a part to play in overcoming this disease that took so much from us in this past year. Again, the vaccines are the key to that. So I also want to thank everybody at the Black Doctors Consortium, Dr. Ella Stanford, the COVID-19 consortium, because what they did and what Penn Medicine has done and all the healthcare providers, they are working overtime to get shots into everybody's arms, and that is the key to Pennsylvania's success. Our healthcare heroes who have gone above and beyond to care for their fellow Pennsylvanians throughout this pandemic. Before the vaccine, they were caring for patients. They have been doing everything that could have been asked of them to make our communities safer, and that's why the vaccine rollout is going as well as it is. And let me just brag a little bit about how Pennsylvania is doing. Over half, actually, as of this morning, 50.3% of Pennsylvanians have gotten at least one shot. We've administered nearly 2 million doses since the vaccine eligibility opened up to all Pennsylvanians just a few weeks ago. That means that everybody 16 and older is now eligible to get the vaccine. Again, on first doses, Pennsylvania is at 50.3%. The U.S. average is at 44%, so we're way above the national average. Second doses, the national average is 32%. We're at 33%. We're above the national average. Doses used total 79%. We're at 80%, 79.97% according to Becker. We rank 10th in the country in terms of first doses, and we rank first among the 10 most populous states among first doses. So we're making good progress here in Pennsylvania, and that's important for all of us, because when you get vaccinated, you keep yourself safe, but you're also protecting the people around you. You're protecting your family, you're protecting your friends, protecting all community members. And this is important because right now, if you're under 16, you can't get the vaccine. So when you get a vaccine, because you can, if you're over 16, you're protecting all those folks who can't get the vaccine, who have not yet gotten it. Progress we've made in our vaccine rollout in April means that millions of Pennsylvanians have chosen to protect themselves and those around them from COVID-19. But again, we cannot lose our momentum now. Just keep in mind, vaccines are free. You don't need to pay for them. You don't need insurance for them. They're widely available, and they really do make a difference, not just for you, but for your community. And that includes everybody who wants to be a sports fan. Wouldn't it be nice to see more people in the stands? Many clinics have evening and weekend appointments, as Dr. Brennan said, that actually places are opening up right now. You don't even need an appointment. You can just walk in. Vaccines are free, even if you don't have health insurance. So I encourage all Pennsylvanians to make a plan to get vaccinated as soon as possible. I waited until every Pennsylvanian was able to get the vaccine, and so I made an appointment, and 2 weeks ago today I got my first shot. 2 weeks from today I'll get my second shot in York, Pennsylvania. So it's important that we all get that vaccination. Getting vaccinated is a way that each of us can play a part in making sure that we defeat this disease. So listen to Gritty and take your shot. Thank you very much, and now I'm happy to take questions. Yes.
Maybe at some point offering vaccinations at games, as it's been done at other places.
Well, there's an idea. Yeah, sure. Yeah.
Happy to do it.
That would be great. I think we're looking for all kinds of ways to get people to overcome the hesitancy, and most of it's just sort of sitting on the fence. It's not really a profound antipathy to vaccines, and things like this, the partnership of the flyers really helps, and so yeah, that would be great.
And you mentioned returning to normal today, as you probably heard. New Jersey announced that it will be fully reopening with social distancing and masking, of course, on May 19th. Do you have an idea of when that might happen in Pennsylvania?
We're talking about that every day. I want to go as fast as I can. I think, again, this just came out, but I think they're still a little more restricted than Pennsylvania is. So I think we're actually ahead of them. But yeah, I want to go as fast as I can. I don't think anybody wants to drag their feet on this. We just want to be safe.
A certain vaccination rate before reopening? Are you looking at a certain number?
I don't think anybody knows what that rate should be. I mean, again, yesterday even Tony Fauci was saying, I don't even know what herd immunity is and what that constitutes. So I think we just want to get to the point where we can feel safe and that we can get back to life as normal, and so we can pack stands like this.
Today, the New York Times had a story in which they quoted Anthony Fauci and other experts saying that they don't believe the U.S. will reach herd immunity, at least not anytime soon. Do you agree with those?
Yeah, well, I'm not a medical professional, but I read the article It was done a few days ago, back when I think the U.S. average was 40% in terms of 44%, I think, in first doses. So the United States has gone beyond that. And I think what Dr. Fauci was saying is they just don't know what that herd immunity is. In other words, where everybody really is 95% certain they're not going to get the vaccine, or they're not going to get COVID. But between now and then, we can get to a point where it is just another disease. That's what the article was saying. So again, I'm not a medical professional. I'm still optimistic that we can get to a point where we can get back to life as normal. Whatever you call that, that's what I want to be. Any other questions? You're it. So go ahead.
What do you say to folks who may be still on the fence about vaccination and then hear experts like that saying that they're uncertain about herd immunity, and maybe those folks who are still on the fence saying, well, why should I get a shot if we're not going to reach that point anyway?
Well, actually, if you just read the headline and not read the article, you'd say maybe I really should get a vaccine. Because if there's a concern that we're not getting to 70 or 80%, again, Fauci said, I'm not even sure what that number is, but if we were to get to herd immunity, the only way we get there, whatever that number is people get the vaccine. So if you were to see that headline, it seems to me, if anything, it would make me want to get the vaccine rather than be more hesitant.
Sorry, I know the doctor was speaking to this as well, but have you been able to talk to Philadelphia officials? I know the rollout is separate from Pennsylvania's,
right.
But have you been able to talk to them about some of the issues they're facing now with the vaccination rate stalling a little bit? Do you see it as more access issues or hesitancy or both, and how do you address that?
No, I think that's a normal thing. I mean, it's happening all across the country. There is a decline in the rate of uptake, and I think that's when you sell things that are hard to find, you immediately have a lot of people that are taking it up at the get-go, and that has to decline, that rate of increase. So I think I'm still optimistic that we're going to get there. If you look at some of the statistics among the people who were in line first, the elderly, people over 65, in Pennsylvania, we have over 90% uptake. And I would have been thinking that, we optimistically maybe get 80%. So if that's any indication, I think it might take a little longer. It might take us a little extra effort, like what the flyers are doing here. But I think I have every reason to believe, have a sense of urgency, but that we are going to get more and more people to take this up. All right. Hey, thanks a lot. And again, flyers, thanks a lot. And we're going to have a conversation, I guess, about something.
Yeah.
So I really appreciate this, and please give my best to Gritty. I really appreciate his willingness to come out and liven this thing up. So thanks a lot. Thanks, everybody.